Our teens are learning so much about sex via the internet, which is, not a great resource to learn about sex.
A big part of our early education really lacks a focus on pleasure.
How many people are out there who are really struggling and are having really difficult conversations with their partners at home, and it's adding a lot of strain to their relationships, when actually we can help.
What are some of the myths that you've encountered on social media about sexual desire?
Oh God.
Dr. Lisa Thomas-Emrus is a highly respected medical doctor, lifestyle medicine expert, clinical sexologist, and certified meditation teacher. With extensive experience in both the NHS and private practice, she offers an integrative approach to sexual health, addressing the physical, emotional, and relational aspects of well-being. Whether you're navigating intimacy challenges, managing chronic stress or health conditions, or simply seeking to feel more connected and pleasurable sex, Dr. Lisa provides thoughtful, evidence-based guidance to help you reclaim your sexual health and sense of self. Stay tuned, this is a conversation you won't want to miss.
Hi, Dr. Lisa. Thank you so much for joining us today. I might just get you to start by introducing yourself, what you do, and why.
Yeah, so thank you for having me. It's late here compared to where you are over there. So I'm on the other side of the world in Wales, in the UK, and I'm a doctor. So I'm a family physician or a GP, and I specialize in lifestyle medicine as well as clinical sexology. So I often look after women's health when it comes to sexual wellness. So that's a big thing that I do here. But as a GP, I basically see anyone and everyone from cradle to grave and look after their long-term health. And my main passion is helping people to live a really full, long, well life that they really enjoy as best as they can, and make sure that health challenges aren't having too much of a negative impact. So that's my main passion.
I love that. I think that intersection between lifestyle, sexuality, and our general health and well-being is so important. So you have the full spectrum of skills that everyone needs and wants.
Well, that's
So
why. So when I got into lifestyle medicine and got into like the preventative healthcare and wanted to try and get as many of my patients to live well until they were 100, um, I was kind of looking at what else can I add into the toolbox to tell them, like, this is another added thing that you could be doing to improve your health and well-being that isn't just me prescribing a medicine. And that's when I found like all this research into sexual wellness and how our sexual health is a real marker of our general physical and mental health. So it's so important. But, traditionally in the medical field, like, I don't think we put enough spotlight on how important a good healthy sex life is for our overall health. It's just been the kind of a thing that's still a bit of a taboo topic, even in the medical
Mhm.
world, where we talk about anything and everything. And we don't really look at the side of, well, actually, if you enjoy your sex life, you live longer. That's a basic fact. So why aren't we like shouting that off the rooftops as something for people to do to improve their health and well-being? We're all bored of hearing how let's smoke less and let's stop drinking. Now, what about let's have more enjoyable sex to help us live longer? I think more people would take that advice on board.
Much more appealing than smoking less and drinking less. Well, maybe not smoking less, but drinking less and
Yeah,
eating
well,
better and
funnily
getting to
enough,
the
my
gym.
patients
Much
seem to,
easier.
yeah, they do seem to remember when I give them that advice, and they spread the message. So,
I
good.
love that. And I think that's why this conversation is so important because I think you're right. It still is unfortunately taboo in our society for people to raise that topic. And I think there's two sides of that. I think there's firstly the patient or the client or the individual walking through the door who may not feel comfortable talking about sex because of a whole range of reasons, which I'm sure we'll get into today. But also, as you said, I think that health professionals are still sometimes struggling to have that conversation, unfortunately. And that's why I love that you have pursued this training because I'm sure you're also sharing that amongst your networks, just as I am in clinical psychology. And I think it's so important that we destigmatize these conversations, not only in the general population, but also as health professional, and as you said, highlighting the important outcomes associated with sexual satisfaction, for example.
Yeah, absolutely. And just the importance of that as the healthcare professional when someone comes to see you, but whatever that condition might be, I think it's just important just to, open the door into the conversation, whether, if the patient doesn't want to talk about it there and then, that's fine. But just asking the question, is this affecting your sex life? Or is this affecting how you feel about intimacy with yourself or with your partner? And it just opens the door to that conversation, and that person might not have even thought or considered or put two and two together. But they might then go away and think about it and think, well, actually, yeah, that's bothering me more than I realized. And actually, I do want to do something about it. But, there's loads of opportunities, especially in general practice where I work, to be bringing up the topic of a healthy sex life, because the amount of time I ask about it, and yes, it's a problem, I then
Mhm.
just think, oh, how many people are out there who are really struggling and are having really difficult conversations with their partners at home, and it's adding a lot of strain to their relationships, when actually, like, we can help make a difference.
And I think that's the key point, isn't it? That even if people are aware that's an issue for them or it's a challenge for them, that they don't always know that there's something that we can do about it to help them. And there's a lot of things, there's a lot of different things that you can try. But I don't think that knowledge is readily available. So I'm really excited to have this conversation with you today. Can I ask you, how common is sexual desire difficulties?
Oh, really common and probably really underreported. So there's not a lot of research into this field. It's not really been an area prioritized. Um, but we think like a lot of the studies seem to suggest that maybe 1 in 5 men suffer with it, which is, that's a high number. And even more women. So most of the studies seem to suggest that it's at least 40%. But
Mhm.
in my like clinical practice with regards to people coming in and not coming in for sexual wellness problems, but for whatever it is, that might be like menopause problems, contraception, chronic pain, thyroid, diabetes, whatever it is, I will always kind of bring up the is it affecting your sex life question. And the amount of people who will say yes is, I would say, the vast majority. Hardly ever do I get a no, like despite this condition, I'm enjoying a really healthy sex life. So I think it's really underreported in studies.
I agree. And I think that you're right that the research hasn't really caught up there. So we see really large windows of prevalence rates where in some studies it might be 10%, and some studies it's up to 70 to 80% of participants. And of course, that's also about the population that we're looking at. And I'm wondering, have you noticed? I know in my work, I've noticed key times or key transitions or developmental stages that couples may be going through, such as the transition to parenthood, where we might see a greater level of sexual desire difficulties, or just, and I struggle with that terminology sometimes because it's actually really normal. So when we label it a difficulty in a time like that, it's actually just a really common part of the context that people are going through with sleep deprivation. Have you noticed some of those key transitions or key periods where we might see an increased amount of sexual desire challenges for an individual?
Yeah, absolutely. It's commonly through all the big sort of life transition moments, or anytime someone's having any other kind of like life stresses that's adding
Mhm.
extra onto someone's plate. But you know, big times are whenever there's any major hormonal shifts in a female, and so things like pregnancy, things like just after having a baby or breastfeeding, and then also then motherhood in general and juggling all the kids' schedules. And then again at perimenopause, maybe again at menopause later on. But what I would say with libido, sexual desire, is that it's it's a normal fluctuation throughout life. We don't expect you to find this perfect partner that you are so attracted to that you are going to want to ravish your partner every night forever. and you'll just always feel exactly the same. It just doesn't work like that. So in the vast majority of long-term couples, there will be a fluctuation, and
Mhm.
oftentimes we don't find that both people in the partnership or multiple people in the relationship, if they're polyamorous, we obviously don't conveniently get everyone having a lower sex drive altogether. That would be lovely. So it varies from time to time and person to person within the relationship. But I would just kind of often reassure people that it doesn't mean that there's anything wrong with you as the person or the relationship as a whole. It's a roller coaster, and multiple things affect our desire and our libido. And it is about just taking a step back, not panicking, and looking at what all the factors are that might be impacting your desire. And then we just go by and slowly address one by one and see what works, and just be continuously like creative and curious about what's going to help. And also,
Mhm.
if you don't want to do anything about it because maybe you both just had a baby and you're knackered and it doesn't occur to either of you, but you're both fine about it, that's fine as well. You don't have to always have sex if neither of you particularly want to have sex. So it's only a problem if it's a problem.
I love that. I think it's so important. And because it's that balance of just saying, like, everyone will go through this at some point in their life. And it's only an issue if it's an issue for you or your partner or both of you. And then if that is the case, we can do something about it. And it's about identifying what it is that, that context and what path we can take towards change. So, can you tell me what are some of the things that contribute to low sexual desire or low libido in men?
So in men, it's very similar to women as well. But the big things that we notice is definitely health conditions. So if
Mm.
a man hasn't been quite prioritizing their health as much, for example, if they put on weight, if they're not exercising as much, they're not sleeping, they might be drinking more alcohol or more stressed with work. Um, all of those kind of lifestyle factors have a big impact. If they've got high blood pressure that hasn't been well controlled, or they don't know about it, or they develop diabetes and they don't know about it, all those things affect the circulation to our genitalia, but particularly to the men. But men have a warning shots. They can see quite clearly if something is affecting their libido because they'll start having erectile dysfunctions. And men don't like that. So men will come and ask for help. And that's the difference between men and women is men are much quicker to come to ask for help, probably because they know that there is a blue pill, like the Viagra, for example, that has been heavily marketed in order for them to actually take something for help. And it doesn't seem to be such a taboo. So we tend to find that actually men will come in saying, "Oh, my mate said that he's on this tablet and it's working for him, so I want the same." So it's really interesting how I often ask men, "Oh, have you spoken to any mates on a golf course about this?" And they'll go, "Yeah." And I'm always fascinated that they are sharing, really intimate personal problems, but they're quite willing to share what works. But when it comes to women, if I say to them, "Or, have you spoken to a friend that you're really struggling with this, it's really affecting you, or you're having painful sex?" They hardly ever have someone that they can confide in, or they they have a lot more shame, I think, about it because they feel like something is wrong and that they shouldn't have these kind of things happen to them. And I think because obviously there isn't a definite magic cure, there isn't a perfect pill for women, they often think, well, nothing can be done. I just have to kind of grin and bear it. And there is a lot more instances then of what's known as compliant sex. Basically, you feel like you owe your partner and you're willing to kind of lie there until he gets on for his pleasure. And you just think, well, that's it. I still love the person and I just don't enjoy sex, but I want him to have his share, so I'm willing to give it without having any pleasure yourself. And that's the bit that we really need to change for women is that kind of thinking of, oh, actually, there is a lot we can do to help you enjoy it again.
Mhm. Absolutely. And in my experience, I'm sure you found the same, that that tends to really start to eradicate trust and builds resentment in the relationship and spills over. So it's so important that we're able to address this. And as you said, increase awareness for women that there are many things that we can actually do to help women who may be struggling for many different reasons with sexual desire. Can you tell us what are some of those things that may be contributing to sexual desire difficulties in women?
So women, the commonest things are hormonal swings. So we know as our ovaries start aging, your ovary produce a bit less estrogen, and then that estrogen makes the vaginal tissues a bit thinner, so you just don't get as good circulation to the vagina. It doesn't lubricate as well. That in itself then can make sex a bit more uncomfortable. Soon as sex is uncomfortable, your brain thinks, I'm not into this, and then you just get into a bit of a cycle. It's really difficult to get out of that cycle. Um, so that kind of puts you off and dampens your own pleasure. But also on top of uh, hormonal swings, where throughout the perimenopause, you'll just have swings up and down of these hormones that will have multiple other effects as well. So it can increase your anxiety. It can make you feel more brain fog. It can really make you feel profoundly exhausted and increase your pain in your joints, your muscle, your skin. You just feel tired. You don't feel good about yourself either. You kind of get this disconnect into your body and you just don't enjoy what your body's doing generally. So if you don't enjoy what your body's going through generally, it's no surprising then that you're not going to have that trust in, oh, my body can actually enjoy pleasure as well. And then also the other things that contribute is things like self-esteem. So women often notice self-esteem changes as life changes for them. They often say to me problems like, I just kind of identify as being this mother and I've lost who I am separate to being a mother, or I just kind of see myself as having to get through all the work, do everything there, then do everything at home, and there's nothing left for me, and I don't even know what I enjoy anymore. And if you just don't have anything you enjoy, other than, of course, spending time with the children that you love very much and your partners that you love very much, but just other things, like hobbies and interests, those basic things are so important for us to not lose who we are as people.
Mm.
So it's those things, and of course, sleep can affect us. So there are so many factors when it comes to women that are psychological, mind factors, physical factors, social factors. What messaging we get from our culture, our religious belief, our family messaging, and all of those things contribute to how we feel about our sex life and how we identify as a sexual being. And that's why there will never be a medication for women, in my opinion, unless you get some really clever pharmaceutical genius, which, cross fingers, you will. But because it's so complex, it's very difficult to design a medicine that will address all of those things in one go.
Mm, I think it's interesting, and I think that's something people don't understand around sexual desire difficulties, or actually all sexual difficulties really, is that there is, as what we would call that biopsychosocial model. So there is biological factors, there's psychological factors, there's social factors, and really to address that, even with men, to be honest. So if it is something like the initial answer is Viagra, I find that some of those other issues do come into play. So, when there has been sexual difficulties prior, it started to affect the relationship. It might be affecting the way they're communicating in the relationship. It might be affecting the relationship more generally. It might be affecting their self esteem, their ability to be present in the moment with their partner. So, I think, for both men and women, we are talking about that biopsychosocial model
Model.
to address
You have to
sexual difficulties, as you're
Yeah.
pointing out.
You've got to be holistic about it with men and women. And that's sort of what I warn men about, because they think, oh, this little pill will solve the problem. But what they don't realize is the impact of performance anxiety. So as soon as it happens, they do get really anxious about it. So they get really frustrated about it. And sometimes, yes, the pill can sort of help rebuild that confidence. And often, actually, if you address that performance anxiety and address the underlying factors, you don't need it. So I always say, well, actually, like, you
Mm.
might not need this pill as much as you think. So, let's not train you to think this is my only solution and I can't function without this tablet, because probably you've just got into that spiral of performance anxiety. You're putting way too much pressure on yourself. And now all you're thinking about is your erection, and not thinking, again, also about your pleasure and your partner's pleasure and how other things contribute to intimacy and enjoyment, not just how bad is your penis. So that, I always think it's worth talking about that with men as well.
Absolutely. And I think, as you said, that cycle that can happen, so once we start having, let's say with desire, if we're struggling with desire, then we start to think we've had a bad experience with sex, for example, because it hasn't been, not particularly negative, but just not enjoyable. So we've had an unpleasurable experience, or maybe a number of unpleasurable experiences. And then, we start to associate sex with not pleasure. So, that kind of gets in our head, and then we don't want to have sex, and it become that cycle, or we might have anxiety about sex. And so we go into sex in that heightened stress state. We're not present in the moment. We're not able to switch off. So being able to address that cycle is really important in terms of the way that we're thinking, feeling, approaching sex. But I also think our ability to be present in sex in the moment is one of the most important things. And I know you do a lot of mindfulness. I just came across your YouTube channel, actually. Could you talk a little bit about that in terms of how that might be? Because I think it's a really practical, easy thing that anyone can do, even if they're not feeling ready to go see a health practitioner, which we both highly recommend you do, because we know that, which we'll talk about in a moment, that sex difficulties can be associated with a number of health conditions and can be an early indicator of those. But, if you're in that place where you're sort of like, I'm struggling a little bit, this is a really easy thing that you can start to do at home. So can you talk a little bit about the intersection between mindfulness and sexual satisfaction and sexual desire?
Yeah, so as part of my kind of mission to help guide my patients towards all the things that they can be proactive in doing to help them live a long, healthy, thriving life where they're enjoying actually being in their bodies. One of the other tools that I came across that it has like tremendous beneficial effects on the way the brain works, the way it builds itself, also like measurable changes in the body as well as things about mood and how we feel and how we think, is meditation. Really simple, really old tool. It's got no side effects, which is like one of the things that I look for when I'm helping patients. So when I found all of this research and started practicing it myself as well, and noticing the benefits in my own life and in my kids' life, I then studied with the British School of Meditation to learn how to be a meditation guide. And then since then, I write meditations for health conditions. So for symptom control of various things. So it could be meditation for blood pressure, meditation for gut health or IBS symptoms, as well as things like stress and anxiety and how to be a bit more present or how to sleep better. And also ones for improving intimacy and connection to yourself. Because, our lives are so busy now, aren't they? And we're so distracted. We've kind of conditioned ourselves to multitask at every waking moment. And even when we sleep as women, we're thinking about the to-do list for the next day or what we haven't got through the same day. So the brain really needs to be trained to switch off. And that's the issue with sex as well, is that distraction or thinking about other things that you could be doing. And if you could be more present and more connected to your partner, that is when your brain will start building connection um, to your partner's brain, and you'll start tuning in a neurological sense and release similar hormones. And you'll have these what's known mirror neurons inside your brain that will mirror your partner's mirror neurons inside their brain. So it enhances intimacy massively. So you develop that sense of connection, but you have to be present. It doesn't work if your partner is thinking about some other thing, or they're thinking about their erectile dysfunction and whether or not that's going to play in. And you're thinking about the fact that you haven't turned the washing machine on, or your tumble dryer is not switched on, or whatever it is that might be distracting you, or your phone is on your bedside table and it's lighting up with notifications. we've got to make sure that you're actually trying actively to get into the zone and focus on yourself and your partner, but importantly yourself as well. For a female, I think you have to also realize that that moment is for you and you deserve to enjoy that time and enjoy that time for yourself, not just doing it because you feel like it's a chore that is yet another thing that you need to tick off until we need to do it again.
Definitely not. And that's where that, negative association starts to kick in, isn't it? And I love that because I use mindfulness a lot and relaxation and in my practice because I think it's so important is being present in that moment, and it obviously helps with a lot of anxiety that we see alongside sexual desire difficulties. Can you tell me what is, so we've talked about, sexual desire, we've libido slipped in there a little bit. We've talked about some other um sexual difficulties that people may face. What is the difference between these terms?
So, well, these days I find that people just switch between libido and desire where they actually mean both things. So they mean how much of their sex drive they are noticing. And so I find these days, especially here in the UK where I work, people do intertwine both. But interestingly, I tend to find that men use the word libido and women use desire. And whether or not that is like a cultural thing that we've been kind of subconsciously absorbing marketing materials where desire sounds more sensual, more feminine. And does that make it kind of less intimidating and less taboo if someone says desire? And I think I'm definitely guilty of that, of using the term desire when I've got female people or people who identify as female in front of me, and use the word libido more with men. And I think that probably just, you know, my subconscious biases as well, unconscious biases as well. And it's probably that, with these kind of medicines for men for erectile dysfunction, they never really put in the word desire as well. It's often to do with erectile dysfunction and libido and not anything more down the desire route. But to me, libido means your ability to have a sex drive and what does sex drive doing, whereas desire is more about what you actually enjoy in your sex life and what is actually turning you on and what's working for you and what your kind of wishes are with regards to your desire. I don't know if you noticed the same out in Australia where you are.
I hadn't thought about it until we started talking about it. And I find it really interesting because I do think with males, you're right. There's something with libido. And I think it is that, as you're talking about with females, that it's more comfortable to talk about desire. That with males, it's almost like it's unacceptable for it to be a desire issue, that it has to be a functional issue. So libido feels like it's something that we take this pill and we fix our libido. It isn't about me not wanting to have sex, it's that I can't have sex. And for some reason, we see the opposite with females. It isn't about them not wanting to, not that they can't have sex, that they don't want to. I find that really fascinating actually that, as a society that we use this different language to describe the exact same issue, because it makes sense in some of those what we would call sexual scripts around sex for males and females and the beliefs that they've grown up with. Just thinking about that, can you talk about what a sexual script is? Because I'm thinking people tuning in may not know what that is and what we're talking about.
So I don't ever use the word sexual script here, but when I think about it, it's more about what kind of things you've always been told about sex and what you've always been educated, what have you been told when it comes to religious beliefs, cultural beliefs, what's your messaging from your family, what did your school say? So when you had your first and probably only sex ed session, what did they say about it? Was it in the girls' class that if you were going to have sex, it was going to be ending in pregnancy or infection, and that's it. And then the boys go up to a separate bit, and then they're told about condoms and how actually like use this all the time, whether or not you're trying to have a baby or you're just having sex for fun. But I don't think I think like the messaging is always different in the girls' classroom versus the boys' classroom, and it's very difficult as a female to forget those early messaging, whether or not you kind of remember them consciously or not. It will have started off with a relatively negative messaging about pregnancy when you don't want to get pregnant and infections when you don't want to get them. So I think that's the main thing, is to kind of address and think about, well, what are the messaging that I've always been told and what people around me say, or how do I feel when this topic comes up, when it comes up in media or in a film or in a book, what kind of thoughts instantly come to me? What is my natural instinct and a basic reaction to this topic in the first place? And that can help you kind of explore what are those messaging that you've always been exposed to.
Absolutely. I think that so many of us aren't aware of those beliefs that we have around sex, and maybe shame or guilt that may be attached to particular topics around sex, and why we might have difficulty talking about it, because I think a lot of people do struggle to talk about sex, as we've talked about. Um, yeah, it's fascinating. I think that, when you were talking then, I was also thinking about a big part of our early education really lacks a focus on pleasure. So it's very much about, safe sex, which is understandable. We want to stay safe, and that's really important. But there tends to be this lack of focus on pleasure when we first learn about sex. It's all about, as you said, how not to get pregnant or how not to get an STD, which is important information. But I think an important part of learning about sex and really learning about consent is pleasure, because it's about not just, am I okay initially when I give consent around sex? Does this feel good? Does this still feel good? And I think that that is not just about young people. We're talking about adults as well, that I think we can get caught in a sexual script that if we initiate sex, or if we say to our partner, let's have sex tonight, and then for some reason something changes for us, we feel tired or just don't feel into it, that we feel that we have to keep going instead of saying, hey, tonight's not the night, or today's not the day. um, let's try again later. And I think that that's really important, that focus on pleasure and building a positive association around sexual interactions with our partner.
It feels like that's sort of more important than ever, really, because things are different these days. Our teens are learning so much about sex via the internet, which is, not a great resource to learn about sex, because obviously porn is so easily accessible, no matter how old a child or teenager is with a smartphone. It's easy to access, and it's not a reflection of what normal day-to-day um, sex is like for the vast majority of the population, or certainly not your average session, I would say. But if young teens or younger are starting to watch some of these more aggressive porn films, and that's what they're learning. That's what they think. Oh well, this porn star here must know what they're doing. They're the experts. Then that's a totally different messaging, isn't it? Rather than what we used to have, which was learn through experimenting with someone else who was equally naive and learning as they go. But the problem is now is that you're getting exposure to these films, and then people are replicating them without actually knowing or understanding that they don't even enjoy it. They're just copying it because that's what they think they should do. And I've had that multiple times with young teens where I'm doing contraceptive checks with them, where I'm asking them, I'm sexually active, and can I ask you what you understand about how to give consent? What do you do if you change your mind? How comfortable are you in changing your mind and speaking out about it? And has anything happened where you've not quite sure if that's right or if that's normal, or should you be enjoying it? And the amount of times I get, a 15-year-old or a 16-year-old girl saying, well, I didn't really like it when they started strangling me. I thought that was a bit weird, but they said it's the thing. And I think, well, I bet the 15-year-old boy didn't enjoy it either. They just watched it thinking, well, I want to look really good at doing this, so I'm just going to do this. And I just assume this is what normal sex looks like. And then I've got to go
Mm.
back and explain, well, actually, no, that's not standard sex. And you shouldn't be doing things that you're not enjoying or you don't have any understanding of what that means or what that is supposed to make you feel and why some people might really enjoy that kind of sex. But it's unlikely to be things that you're doing when you're just starting out and stick to the basics. But you don't get that kind of chat in your school sex ed. And I think what we need really is more specific people to go into schools and give this education. So you're not just asking, your religious education teacher, like it was in my day, to give the sex ed talk, because, it's a tough topic for the
Mm.
vast majority of adults to talk about it with their long-term married partner, let alone a teacher to talk to teenagers who know nothing about the topic. It must be difficult. But I think we need to have people who are educated in sexuality and sexual health, who are confident and have no issues with thinking that sex is taboo. So you can go and have an open topic and make it not uncomfortable for anyone.
Absolutely. It's the starting point for change, isn't it? The education system and changing things there. And I think, even in adult populations, we see that reverberate even now, when you're working with clients, whether they be in their 20s, 30s, 40s, 50s, 60s, beyond, that those ideas and those beliefs around sex are still present. And a lot of people struggle to focus and talk about the idea of pleasure and what their partner might enjoy and have those conversations with their partner. So it's interesting, yeah, I think to see that reverberate through the years and still see the impact now. What would you say to someone who maybe isn't enjoying sex with their partner at the moment, or wants to raise some things they want to try, or is struggling with desire and wants to talk to their partner about that? How could they start that conversation?
Well, I think it's first off, it is well worth the conversation, because you don't really know what your partner's thinking either. And at the end of the day, your partner is always going to enjoy having sex with you when you enjoy it as well. That's always going to be more pleasurable to all involved rather than one person being really into it and then knowing, oh, the other person is not really that much into it, but they're just going along with it because we've been in a long-term relationship forever. So it is well worth addressing and making the conversational, non-confrontational, not kind of accusing anyone. So not, I would say, like, don't start with the words, you make me feel like this, or when you do this, it doesn't work for me. Switch it into that you're only talking about yourself, and where you're saying, oh, I'm a bit concerned that, you know, I, I may be not enjoying things as much as I want to, but I do want to enjoy it because still find you attractive. I still love you, and
Mhm.
reassuring the other person that it's not a reflection on the relationship as a whole, but more as a, can we work this together? And, can we explore new things together? Because if you've been in a long-term relationship, actually what you need to reintroduces a bit of novelty. That's why it's always very good at the start of most relationships, because it's new, it's exciting, there's a bit of mystery, and our brains like that. Our brain likes that side of adventure. The problem is our brain also likes stability and security and uh, that sense of um, deep connection. But they're obviously the opposite end of the spectrum. So, you know, but the nightmare being a bit of a human being really, isn't it? Because the brain wants two things all at once. It wants novelty at the same time as security, and
Security.
yeah. So being with your partner and then coming from a place of, let's explore together and let's think about new ways. And have you thought about anything you want to try? And let's think about things together and see what we match up on and see what we want to explore. and just take that kind of playful stance with it, where you're not making the other person feel defensive straight away that they're not doing things. You don't want them answering back saying, well, it's always worked before, so it must be something wrong with you because I'm just doing the same thing as you've always done, and you've always said you enjoyed it before. Whereas if you kind of think, well, things just evolve, and the female body does evolve, and it needs different things at different times. I think that's the most important thing. And if things do get really difficult, you're finding that every conversation ends up in an argument, or it's adding more and more strain, then think about going to see uh, a clinical sexologist or a sex therapist or a relationship therapist, someone who can help guide the conversation so that it's not actually making things more difficult.
Absolutely. The key is really being able to talk about it, isn't it? And have that open communication. As a lifestyle practitioner, what do you think are some of the things that we can do from a lifestyle perspective to address low sexual desire?
Well, loads. So there's loads of evidence behind lifestyle factors and their impact on creating a healthy sex life for people. So first off would be addressing all the pillars of lifestyle medicine. So lifestyle medicine has six main pillars, which is sleep, nutrition, so healthy food, movement, so exercise, stress management and your mental well-being, your sense of connection to yourself and the connection to other relationships in the society, and also minimizing harmful behaviors. So things like reducing smoking, alcohol, and any other harmful behaviors like drug intake, or even things like gambling, any of those kind of harmful behaviors that affect your stress levels in general. So addressing each of those pillars is really important. And the main thing that I actually say to patients or clients that work with me is I give them the acronym SEXY as a quick way to kind of address it and for them to think about. So SEXY stands for S is for sleep, so good quality sleep and making sure that you're kind of prioritizing that. If you've got poor sleep, then that does massively reduce your libido and your sexual desire. Um, Next for E is exercise. So most importantly is strength building exercise and not just cardio. You want to be building up your muscle mass as well, because then that can help lift your testosterone levels naturally as well for both men and women. And then X is the stand for explore. So being curious and creative and willing to explore by yourself, plus with your partner, about new things that you need to help with your uh, pleasure quest. So active for explore, and then Y is the winding down and slowing down your day or your week, because we're so fast paced all the time and we just don't have time for ourselves or our partners. And that often becomes like the last thing on the list to do, maybe last thing at night. So after you've managed to do everything, you work, you sorted out the kids, you tidied the kitchen, you've done everything else, your life admin, etc. And then just when you're going to bed, absolutely exhausted at night, you're thinking, oh, right, I've got one last thing. There's a partner in this bed with me now, and we're here now, so I better do that as the last thing, even though I'm exhausted. Well, wind things down so that actually you've got time and space so that your relationship and your pleasure is not being really low on the priority list, and making sure that you're winding away from screens and all the digital devices you've got around us. It is stopping us from being really present and mindful and in the moment. So yeah, so that's my little sexy acronym to remind people of the main things
I
to
love
focus
the
on.
sexy acronym. I think it's fantastic. And I think you're so right that last part around winding down is so important because we're not present and we're exhausted and we're stressed out, all those other things that you touched on. And touched out actually is a big thing that a lot of I know women experience in terms of having children and feeling very touched out. So I think that's so important to highlight is this sense of when we're not connected with our own body, when we're not in our own body, when we're totally exhausted, how could we possibly have the energy and the desire to do something else? And then it just becomes something else on our list as opposed to something that we want to do. And I think that connection piece is so important. Can you talk a little bit more about that? That idea of being connected, I guess, with yourself and with others?
Yeah, because I think it's so easy to lose ourselves in the busy modern day life where you're having to juggle so many things and so many identities, where often you think, well, I'm this person in work, I'm this person at home, I'm this person in this role where I'm a caregiver, or, this social situation, I'm this person, but with this group of friends, I'm this person. And often then you're kind of left in the middle thinking, well, who am I now? And, life has changed, I've moved on, I've changed in years in body. So who am I now and what do I enjoy now? And just accepting the fact that, you do change and the things that you like do change. And that is fine to explore and find what's new for you now. And I think that's why it's so important just to wind down and slow things down. So you've got time to connect to yourself and think about who you are as a person and where you want to go and what you want from your life and your sex life and your health in general. And when it comes to connection, I think the key when it comes to being in a long-term relationship and losing that kind of spark maybe is that actually you become so um, predictable to your partner and to yourself, but actually that kind of loses a bit of its mystery. So actually, if you start going out there and starting with your own interest or hobby or something that you're passionate about, it just brings up a whole new lease of life in you where you do start developing that sense of connection to yourself then. And that in itself is attractive to your partner because your partner will think, oh, actually, like, there's a new angle to this person.
Mm.
They've got a bit of themselves that I don't really know, and they're getting pleasure from this half of their life, which is not coming from me. And actually, that sense of being independent is really attractive. So I think that's another thing to kind of think about is actually what you need to be focusing on is not just how do we build your sense of connection in the bedroom or sense of connection to your own kind of sex life, sexual desire, your ability to orgasm, those kind of things, but actually how do we build that pleasure in all aspects of your life? You can't just think, well, you're not really enjoying any bit of your life, but we'll try and get you to enjoy just your sex life. You need to think, right, how do
Mhm.
we build enjoyment everywhere so that it's not so pressured on one area of your life? And that's often the a key factor.
I love that because it is that holistic approach, isn't it? And it's so true that when we start to address those things like connecting to ourselves and doing things for ourselves and feeling more of ourselves, that those issues self resolve because that's actually more of what the underlying cause of the sexual desire is. You've made so many great suggestions there that are fantastic because people can just action them straight away. So if they're struggling with desire, they can get out there and they can start trying some of these things. But I also do want to highlight because I know that we're very aware that sometimes sexual difficulties can be an indication of something else and there can be underlying they can be a mental health condition, but also medical condition. So, I just wanted to ask you, what are some of those medical conditions that may be related to sexual difficulties? And to be clear, this is not to say, obviously, if people are having sexual difficulties, it means they're having a medical condition or a mental health condition. Absolutely not. As we said, a lot of people will be able to resolve these issues through lifestyle changes. But I also want to highlight that sometimes there may be an underlying reason why we're experiencing sexual difficulties.
Yeah, so I think the important message is that when it comes to sexual difficulties or low libido or low desire, it doesn't mean that anything's wrong. So we don't have to over pathologize and say it is something wrong with your body and you're broken. Most of the time, no, you're not broken actually, and these kind of lifestyle factors are really important. But if there is underlying physical or mental health problem or medications can commonly cause problems with libido and sexual desire, then we can address those as well and treat those appropriately. But the lifestyle factors are still really important. They're still really key. So there are certain medicines that we can use because oftentimes physical conditions could be related to hormone problems or hormone imbalance. It might be that you've got problems with the vaginal tissues. It might be that the vaginal tissues have got really thin or really worn, or you've got a problem with vaginal dryness, and we can use certain therapies for that. It might be that we need to use HRT, for example, in the menopause or the perimenopause stage, and just top up the little that you're missing. And often, if it's related to that, then things will naturally then improve as long as you're doing the lifestyle factors as well. As soon as your brain starts not enjoying sex, it just remembers. It's really difficult to get the brain to forget things. So, sometimes the medicines aren't just a quick fix, I would say. So, the other things that we look at is what medications are you on, and are any of these contributing to the problem, and do we need to change those? For example, antidepressants are really common things that can affect our sex life. And unfortunately, you can get those side effects straight away as soon as you take the medications. They can appear if you've been on them for a long time and then suddenly cause it as a side effect. And unfortunately, those side effects can last even after you've stopped the medication. So we've got to be really careful and mindful when we are prescribing antidepressants that they can have a big impact on someone's sex life. So to ask, so that's often my messaging when I'm going out and educating colleagues, is if you're doing a review of someone's depression management or anxiety management and you're looking at medications, always ask, is this having an effect on your sex life? Is it affecting your ability to climax? Is it affecting your ability to have an erection? Do you have no desire? And address it and do something about it. They shouldn't stay on a medicine if they are getting that side effect, because it is a very significant and serious side effect that they shouldn't put up with. And things can be problems with prolapse maybe, or recurrent urine infections. Those are things that can put people off. They might have painful conditions. They might have conditions like fibromyalgia, things that cause long-term pain in the rest of the body. They might have chronic fatigue syndrome. So lots of things, as well as common things like blood pressure problems, diabetes, heart disease. All of these things can have an impact. So it's well worth chatting to your family medicine doctor and just coming out and ask the question, say, I'm having problems with my sex life. Do you think it could be any of my medical conditions or any of my medicines? Or is it worth me having a checkup to rule out physical or mental health problems? Can you help me? And putting it as bluntly as that, it will open the door for them to do the job.
It's so important, and it is so important to consult your medical practitioner, because, as we know, when we come off those medications, we need to do it a certain way, and we may need to taper off, for example. So I love that you are raising, because I was going to ask you that. How do you approach, a health professional about that? And as you said, it's just being that direct. So just asking them, straight up, like, these are the difficulties that I'm having. Could it be this? Or these are the medications. They should know the medications you're on. But yeah, having those conversations with that practitioner.
Yeah, because your
And
healthcare,
if you
it
don't,
is a partnership between you and your healthcare provider, and it is about you knowing and owning your body and how it's affecting you day to day, and kind of sharing that with your healthcare provider, and then being able to listen, ask the appropriate question, and be able to guide you to what the best advice is. And from a healthcare professional, it's fine if you don't really know either, and you can take your time. This is not something that has to be addressed there and then. So this is another
Mhm.
messaging that when I go and educate colleagues, is to say, if you're not sure, don't don't panic. This is not emergency medicine here. You can get the person to talk as much as they can, and just keep asking open questions so that the conversation flows and they share as much as they're willing to share. And then you can take that information and go and read up about it. And then tell them, I'm going to ring back actually when I find where's best to signpost you or how best to manage things, or, I'm going to take my time in having a look through all your medications, because, it is hard if someone's on multiple medications or you're not that familiar with which one cause sexual side effects. You can take your time looking at and reading through side effect profiles, and you can ring someone back. You don't have to address it there and then. And I'm sure most people would appreciate that you're going to go and take your time to give them the best advice, rather than kind of blundering your way through it and just kind of making them feel not heard and uncomfortable, because you don't want to miss that opportunity. You don't want them to kind of lose trust in healthcare providers, because we're there to help people no matter what their problem is, and help guide them to where's best to find the solution.
I love that education because it's so important, and you're so right. A big, huge part of it is the relationship and the trust to open up to a health practitioner. And I'd also say, and I'd say the same thing with therapy, if it doesn't feel like a good fit, try someone else. The health practitioner will not take that personally. There's a number of reasons. It may not be that the health practitioner is doing anything wrong, but it may just be for whatever reason that's not the person that you feel comfortable with. And it's okay to book an appointment with someone
Someone else.
else,
Yeah, absolutely.
So if the
Same in
first
our
conversation
practice.
doesn't go well.
Yeah, same in our practice. You'll find like one of the other doctors who are, excellent, really experienced doctors. If it's something sex related, they'll often say, "Oh, well, Dr. Lisa, she loves talking about that, so book in to see with her, because you'll talk with you all day about it." And that's fine, because
So everyone listening, all you need to do is just call Dr. Lisa.
each of us have different passions when it comes to health. So it's the same as, my other colleague loves talking about diabetes all day. So if someone comes and they really want to chat about the ins and out of diabetes, I'll say, "Oh, if she loves diabetes, you should talk to her about it." So, you'll often find you can just be guided towards someone who works in that field. It just, unfortunately, is that there's less of us on the planet who work in this field of sexual health, sexual wellness, because it just hasn't had the spotlight. And that's what we need to do. And that's hopefully like the podcasts like this, that we can kind of raise awareness to go, well, actually, we need to change the conversation and make this less of a taboo topic, and make it more about health, and how actually this is related to good health for any and all genders.
Absolutely. And more of a focus, not just in school education, but in our own education as health professionals, I think is really important. I want to ask you, what are some of the myths that you've encountered on social media about sexual desire?
Oh, uh, oh God, there's so much, odd stuff that you come across on social media, particularly if like me, you Googled a few dodgy things, and then your phone obviously thinks, "Oh, this person's really into it, so I'm gonna start exposing it to weird and wonderful Instagram accounts, etc." But I think like common things are, if you need lubricants, that means that you're not turned on. That means that it's not working, or you're not attracted to your partner. So that's a common one that I come across. And, lots of the patients I've seen over the years, when I tried to introduce lubricants, they've gone, "Oh, well, my partner is going to think that, I'm not turned on and I'm not attracted to them anymore. And it's going to show that my body doesn't work." And that's an absolute myth. Lubricants are pretty much essential for most people, I would say, and it definitely helps enhance it. You just need a good quality lubricant. So that's my point on lubricants before I start ranting about lubricants. The other common myth is all men want sex all the time with anyone. Um, and that's a really negative messaging in itself, because uh, it means that then if men don't want to have sex, they feel like there's something wrong with them. It also builds into that messaging of mistrust between partners as well. If they think, "Oh, well, my partner is just going to want to have sex with anyone and everyone who's walking past them."
Mm.
Um, and then what else? I guess things like porn is like a good way of educating yourself and learning how to be good at sex. that seems to be like more of a modern one, I would say. What other myths? Oh, that and like all women through the perimenopause and the menopause don't want sex. That's not actually true. And actually, lots of women will have a really good sex life in the menopause and after the menopause. So
Mm.
it's not, oh well, you're done. As soon as your fertility stops, that's it. Then sex is not for you anymore. In actual fact, I have lots of women who go through the menopause, and when the symptoms are well controlled, or if they don't have symptoms, actually, they feel totally free to enjoy their sex life as much as they want, because now sex isn't connected to fertility and that concept of being a mother. So now actually they can really own it just for their own pleasure.
I think another big one is around orgasm and penetration.
Oh, yeah, yeah. So, and again, that is like porn contributing to that, because, porn stars seem to show that they have orgasms with penetration, and same with movies, I guess. So it doesn't even have to be porn. How many even mainstream movies or TV shows where the female character is orgasming just through penetration and has no vulval or clitoral stimulation. Pretty much most, non-erotic films or non-intimate films, they don't actually show any vulval or clitoral stimulation, do they? Because that would be like, too explicit. So actually, that again is messaging that we get throughout our ages, particularly when women don't watch as much porn. So all they'll ever see of other people having sex is through a woman having vaginal penetration and that ending up with an orgasm. And actually, the vast majority of women can't have an orgasm that way. Often you can train yourself to do that if that is an absolute goal that you have, but it certainly doesn't mean that there's anything wrong with you. And that actually, the vast majority of women will only reach orgasm if they are using vulval and clitoral stimulation at the same time as penetration.
There is so much we could talk about. I feel like we could talk for hours. But I know it's getting late there. So I want to ask you one last question. If you could impart one piece of knowledge or one skill on all humans to improve their sex lives, what would it be?
And one skill. So I guess one skill would be the ability to talk. I think that's the most important thing, is the ability to actually address things without judgment and without shame, and just be a bit more curious and extroverted when it comes to this topic, and when it comes to your own pleasure over time. So I think that's the biggest skill, but obviously it's really hard to develop that, particularly when, it's been a hard topic to talk about for millennia. So that, I think, is a really good skill to build that intimacy with yourself and with any partner that you've got. And just, standing up for yourself and valuing your own pleasure and realizing that actually you are totally deserving and worthy of that. And no matter what your religious belief is, or which God you believe in, but actually, your God has created a body that has been designed for pleasure. It wouldn't have put those bits in there if if it wasn't designed to be pleasurable. So, address those cultural and religious beliefs and realize that your body is there to enjoy, not just to do, it can do lots of different functions. So yeah, that's my main thing, I think.
I love that. Obviously, as a couples therapist, I love the focus on communication. And I think that's why conversations like this are so important in addressing those beliefs and those beliefs around pleasure and just normalizing having these conversations with each other and people to be able to hear that and feel more informed, to be able to raise these conversations with their partner or with their health professionals or with their friends. So to be able to communicate more about their experience.
Yeah, and realize that like they're not alone. That's the thing, is like, they're not alone, and pretty much everyone goes through these stages throughout life. So it's not anything to be worried or stressed about, and that there's always solutions, and there's multiple solutions.
Absolutely.
Yeah, no, thank you for having me and having this chat with me, because I love talking about this topic, and a lot of my
Me
friends find it
too.
really taboo as well. So I really appreciate it when someone else wants to talk about it.
Absolutely. It's definitely one of my favorite things to talk about. And I agree. And I absolutely love having a medical practitioner to have this conversation with as well, because I think that that is obviously just enjoyable for me, but I think really important for people to hear that, GPs and medical practitioners having conversations like this so they can feel more comfortable to raise these topics with their doctors.
Exactly. Yeah, come and talk to us, and yeah, don't worry if your doctor is uncomfortable. That's their problem.
That you'll find people like Dr. Lisa out there. You just have to look for them.
Yeah.
Thank you so much, Lisa.
Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.